Hello, my name is Dr. Martin Janout. I'm fellowship-trained orthopedic surgeon at Northwest Orthopaedic Specialists, and I specialize in elbow, hand, shoulder, wrist, trauma, and fracture care. I also specialize in treating hand, shoulder, wrist, and elbow conditions, such as carpal tunnel syndrome, hand, wrist, elbow, and shoulder arthritis, tendon lacerations, and hand and wrist deformity after brain and spinal cord injury, among many others. I also have additional training in shoulder replacement surgery for arthritic and post-traumatic conditions. In this video, I will be discussing hand and wrist arthritis. Arthritis is a condition characterized by inflammation of a joint. In a diseased hand or wrist, inflammation causes pain and stiffness. Arthritis is caused by normal wear and tear in the joints of your hand and wrist. It may also develop as a result of a traumatic injury, such as a broken wrist or wrist sprain. There are many different types of arthritis that occur in the hand and wrist. The most common type is osteoarthritis, which is a progressive condition that destroys the smooth articular cartilage covering the ends of your bones. Healthy joints move easily because of articular cartilage. When the bare bones rub against each other, it results in pain, stiffness, and weakness. Rheumatoid arthritis is the second most common type of hand and wrist arthritis. Rheumatoid arthritis is a chronic disease that attacks multiple joints throughout your body. It is symmetrical, which means it affects the same joint on both sides of your body. Rheumatoid arthritis is an autoimmune disease. This means that the immune system attacks its own tissues, resulting in joint deformity. Hand and wrist arthritis is initially treated non-surgically. Rest and change in your activities is common to avoid provoking more pain. Anti-inflammatory medications should be taken, along with applying ice to your hand and wrist for 20 minutes, 2 times a day to reduce inflammation. Physical therapy exercises may improve the range of motion in your hand and wrist. Keeping your hand and wrist immobilized while still protected for a short time can help relieve pain. If the pain worsens, a cortisone injection to your wrist can provide some relief. Early evaluation by a surgeon is helpful in the treatment of hand and wrist arthritis. Delaying your evaluation may lead to severe deformity, especially rheumatoid, that may not be surgically correctable. If your hand and wrist arthritis is not relieved with non-surgical treatment options and is still causing you pain or disability, surgery may be necessary. There are 2 surgical options used to treat hand and wrist arthritis. The first option is a fusion, which can be performed for any joint in the hand or wrist. In the wrist, a fusion can be partial, in which just some of your bones are fused together. This will eliminate pain and allow you to retain motion. When your arthritis is extensive, a complete fusion may be necessary. During a complete wrist fusion procedure, for example, all of the carpal bones are fused together as well as the radius. This will eliminate wrist motion but does not affect forearm rotation. During this procedure, I will remove the damaged joint and replace it with an artificial device called prosthesis. This procedure can help retain or recover your hand and wrist function. Surgical treatment of arthritis in your hand and wrist is generally very effective in reducing pain and restoring range of motion. Recovery time and rehabilitation plans depend upon the type of surgery performed. To learn more about hand and wrist arthritis, please visit our website. Thank you for choosing Northwest Orthopaedic Specialists.